citizens and residents to adhere to the health and precautionary measures to ensure a successful implementation of the normalization plan.
The Cabinet decided in its weekly meeting to adopt a structure to establish an entity concerned with following up and implementing the requirements of the health authorities. Here's more with Nadia Ali.
The Cabinet held its weekly meeting last night through video conference headed by His Highness Sheikh Sabah Al Khalid Al Hamad Al Sabah, the Prime Minister. After the meeting, Deputy Premier, Minister of Interior and Minister of State for Cabinet Affairs Anas Khalid Nasser Al Saleh said the Cabinet, at the beginning of its meeting, reviewed a report from the Minister of Health, Sheikh Dr. Basil Hmoud Al Sabah, on the latest developments related to the spread of COVID-19 at the global and regional levels, as well as the health situation in the country after the completion of the implementation of the comprehensive ban and the implementation of the first stage of the plan for the gradual return to normal life, consisting of 5 phases. The Cabinet calls on all sectors of society to apply health requirements and preventative measures, explaining that the measure for the success to the normal life plan is based on the degree of commitment to health instructions and requirements and bearing social responsibility. That is the main element of the transition between the stages of the plan, calling on everyone to cooperate and comply with the health interests of what is in it. The Cabinet called for all to act as one team to confront this pandemic and defeat it, Allah willing. The Cabinet then followed up on the latest developments in the therapeutic and preventative levels and logistical services related to the efforts to combat the spread of COVID-19 and reviewed the recommendations contained in the minutes of the Ministerial Committee meeting charged with following up the consequences of the spread of the virus. The Cabinet decided on the following. First, adopting a structure to establish an entity concerned with following up and implementing the requirements of the health authorities during the implementation of the stages of the return to normal life plan submitted and prepared by the General Secretariat of the Cabinet. Second, assigning the Central Agency for Information Technology to create a central platform for managing government appointments that enables citizens and residents to obtain appointments before visiting the government agency to ensure compliance with health requirements, especially social distancing. Third, assign Kuwait Petroleum Corporation and its subsidiaries to establish and equip medical wards in the halls 5, 6, and 8 at the exhibition grounds in Mishrif area, while providing them with all the necessary facilities, equipment, and tools necessary for their full operation. Then the Cabinet discussed the affairs of the National Assembly, and in this regard, the Council reviewed the letter of the Speaker of the National Assembly, Marzouk Al-Ghanem, regarding the grilling submitted by National Assembly member Mohammed Al-Kandari to the Minister of Education and the Minister of Higher Education on May the 31st, 2020, and pursuant to the provisions of Article 135 of the internal regulations of the National Assembly, will be included this grilling on the agenda of the first upcoming session of the Assembly.
Health authorities are monitoring the situation in areas under lockdown and will lift the restrictions on these areas based on the levels of COVID.